There's probably a couple of 100,000 people in England with long COVID, and we don't yet know whether it might behave like viral illnesses that cause a severe effect but take a long time to get better.
We see patients who are struggling with a myriad of different symptoms. Breathlessness is a really big problem for a lot of people, and people are really desperate for answers, because what we do is many different conventional investigations, so CT scans, lung function tests, and we rarely find anything abnormal. And so these patients are essentially told that their lungs are working fine, and yet they're still really struggling. Now, we are seeing lots of different causes for breathlessness, and we're seeing quite a bit of what we call breathing pattern disorder, when the breathing just becomes inefficient. We're seeing a little bit of post-viral asthma, but one of the things I was really interested in finding out was whether or not there was a structural abnormality within the lungs or within the pulmonary vasculature. And so hence we've started looking at a novel imaging technique called Xenon MRI imaging to see if we can identify any abnormalities in the lungs of these patients.
For Xenon, which is my abbreviation for hyperpolarized xenon MRI, we ask the patients to lie on an MRI scanner and to take a breath in of a bag of polarized xenon, and then we image it. And what Xenon can do that can't be done by other techniques is to watch the gas xenon move into the bloodstream across the lungs in a similar way to oxygen. But it struck me that there was a potential to see how much lung damage there may be from COVID if we did Xenon after the patients were discharged from hospital.
We had initially looked at patients who had been hospitalised with COVID, so essentially those patients that had COVID pneumonia, and found that even when their CT scans normalised, their lung function tests normalised, we could see abnormalities on Xenon MRI imaging. And so then we went on to look at the non-hospitalised patients that we don't even know ever had pneumonia, to see whether or not those kind of abnormalities were still present.
It's called the EXPLAIN study, and we're looking to see if we can use Xenon to differentiate the different groups and see who's got lung abnormalities and see whether they get better or not. And we're going to relate the lung scans to their lung function test, their CT scans, and their clinical symptoms.
Hopefully the sensitivity of this test will give us some really interesting answers, and maybe even help us pinpoint actually what the nature of the abnormality is. Whether or not we see patients that have long-term lung damage that actually has a functional impact, i.e. it impairs what they can do, I don't think we yet know, and this is why we're doing the study, to understand better what the impact of COVID is on the lungs.